left and I was driving home and I was like, that was so terrible. And this is how a lot of parents must feel. And I have my bachelor's in dental hygiene and I am overwhelmed and I don't know what to do. And so then it led to a lot of research and experimentation and different things to feel comfortable, but also to let other providers know, like, hey, there's a different way to approach this. I'm recognizing these parents that have medically complex kids, they're at a lot of appointments and there's already this amount of stress and expectation because they already pretty much, everyone knows that they should be doing it, but it's the how, because it is really tricky when a child will not open their mouth.
A tale of two hygienists.
And welcome back, dental people, to another episode of A Tale of Two Hygienists podcast. I am your co-host, Dave, and I'm here with my amazing partner in crime and perio protocol partner, Miss Jessica Axelson.
Hello.
How are you today? Welcome to July. I feel like July is a steamy month down here and is very hot, and I'm excited for vacation. The holidays are over, and I want to kind of focus back a little bit in the world of dentistry, and specifically being able to kind of talk about how we take proper care with our patients. And let's have a conversation today about how every day could be a little bit different. So just let's talk about our interview today. Who are we going to be talking to?
You guys, we have one of my best dental hygiene friends with us. Like, we go way back. We go back to the very first day of dental hygiene school. We have with us today my dear friend and my colleague and my classmate and my co-everything, Candi Kidd. I'm so grateful that you are here with us, Candi. And I'm going to introduce you all to Candi. And Candi likes to joke that she's the only candy that's actually good for your teeth, which she is. She has a bachelor's degree in dental hygiene and a master's in education. And she is known for her ability to make oral health education approachable and impactful. As a special needs mom, she has a deep passion for improving oral care within that community. Her accomplishments include serving as a dental expert on ABC's Good Things Utah and partnering with Harvard Dental School and Boston Children's Hospital to spearhead innovative dental policy initiatives. Candi lives in a small farm just outside of Boston, Massachusetts, with her 5 children and a cute little cow and a cute little horse and some chickens and her wonderful husband and a dog. Is just the best. There she balances her professional achievements with her love for her family life and the simple joys of farm living. Welcome to this episode, Candi. I have been looking forward to this because you have such an important message to share, and I can't wait for you to teach us how to be better providers for the community that have special needs. And I want to be really respectful about how we have this conversation. And I always think to myself, what verbiage do I use? How do I be most kind and respectful in these communications? And before this episode, I was talking to Candi about this, and we decided that you just ask. Everybody just ask. So, Candi, thanks for directing me, and I'm excited to have this conversation. And I'm curious how this kind of evolved in your professional life to be a focus, care for those with special needs.
Yeah, Jessica, I'm so happy to be here with you two. When we were in dental hygiene school, like, I remember taking geriatrics, but there wasn't a class on special needs. And I remember just a couple times being like, I really could have used some help. So when my third daughter was born, she had a condition called hydrocephalus, and that's where there's too much fluid on the brain. And unfortunately, the only way to cure hydrocephalus at the time is brain surgery. So she's 10 years old now, and she's had 10 brain surgeries. Navigating this process kind of forced us to live in uncertainty and get a little more comfortable than I definitely was before. And because of that, when we discussed expanding our family, we were open to adopting a child with special needs because we were already kind of living in that world. And we ended up through, I think, divine intervention, learning about a little girl named Miley. And Miley is one of 7 kids. She has 6 brothers, and she's the only girl, and her mom passed away unexpectedly. And Miley ended up in foster care, even though her dad tried, he wasn't in a position to care for her. And so Miley, at the time of meeting her, she was living with the 80-year-old woman at a medical foster home. And so the home had, I think, like 8 or 10 children in it, and a staff of nurses and CNAs that would rotate through. And I
Yeah.
remember walking in and seeing Miley for the first time, and it was like her heart knew my heart. She was mine, I was hers. Instantly, I felt the same feeling I felt when I met my biological kids in the hospital. And I remember just, like, looking at her, and I thought, like, my whole being was going to explode because it was this feeling like she's my child. And so I'm having this experience, like an experience I can't even put into words. And then the other part of my hygiene brain is like, "Oh, she has something going on periodontally." Like,
I
it's
can smell something.
and I was like, "Dang, hygiene school, like, ruined me," because this was one of the most spiritual, powerful experiences in my life, and I could still, like, ding. And, so that always sticks out and not something I could share with anyone but a hygienist. But so she has a lot going on medically from head to toe. Seizures, non-ambulatory. She has 19 specialists that we see. But I kind of thought, you know what? I have a bachelor's in dental hygiene. I can at least handle from her nose to her chin. But then she came home and she had blood on her pillow. And
Oh.
because of her complex social history, she didn't want to be touched by me. And she didn't
Mm.
want me to brush her teeth. And I thought, "Oh my gosh, I really, really do not know what to do with this child." Like, I overall, but especially with her mouth, and this is the area that I thought that I would know what to do. And so, the first thing we did was she went under anesthesia, and she had, like, a good exam. They pulled, I think, 8 teeth. They cleaned
Um,
everything and kinda just stabilized. And then we did lots of sensory stuff. My husband's an OT, so he kinda helped, but we did,
that's
like.
very helpful in this
Yes.
situation.
So, otherwise, I would recommend people see an SLP, speech pathologist or occupational therapist, but we did a lot of, like, motor stuff and lots of games and lots of trust, and so it took so long for her to even let me brush 8 and 9.
Mm.
And just to get in her mouth and, with clean hands, I would, like, fish hook her lips and kinda rub them and just get her used to someone even touching her mouth. And so the first time I took her to get her teeth cleaned, I don't know what I was expecting, but I kinda was expecting, like, a gold star. I had never been on this side of the chair as a parent, and you will not believe what I got instead, a lecture on how we could do better.
Oh,
And
okay.
I was thinking, "You have no idea how far we come. She's letting you in her mouth."
Mhm.
And, like, I was just so happy that she was even letting, like, this whole experience, how many conversations and how much play and how many books and how much, um
Like, this is because every day we do something
yeah,
for
and
her oral health, and I'm not sitting eating bonbons, I'm actually doing things to help her become more open to even better care.
yeah, and so they were just kinda like, "Hey, you're missing a lot of spots and stuff," and I'm like, "Hey, we're just, happy we're in her mouth." And then the dentist walks in, he plops down, grabs the air water syringe, and starts to almost spray it into her mouth, and I'm like, "Hey, we don't use water, she's high aspiration risk." And I left, and I was driving home, and I was like, "That was so terrible," and this is how a
Mm.
lot of parents must feel. And I have my bachelor's in dental hygiene, and I am overwhelmed, and I don't know what to do. And so then it led to a lot of research and experimentation and different things to feel comfortable, but also to let other providers know, like, "Hey, there's a different way to approach this."
So oh man, you got me going, Candy, because here's the thing. I'm a parent, I'm a hygienist. these are I have 3 kids, you have 5, so definitely a lot of respect for you because you are I'm just gonna, like, close my eyes and just picture your amazing face and your amazing family every time I walk into an appointment like this, right? Because the last thing I want to do as a hygienist, I think the last thing we want to do as hygienists is to kind of go like pow pow to the patients, right? And say like, hey, you should have, could have, would have, right? I think it takes a lot for us to slow down, take a deep breath, and understand that we all have stories, right? We all come from different backgrounds, whatever, right? But at the end of the day, how can you, now that you have this amazing platform, how can you be the voice out there for hygienists listening and say, let's slow down a little bit. Let's ask more questions. Let's assume less, right? What are some of the tips and tricks that you think I can use starting on Monday to understand a difficult case like this? Because oftentimes we don't know what we don't know, right? And the last thing I want to do is to go to a parent and sound like I'm just like, not giving you your gold star. I feel so bad for you. I'm so sorry that happened. I do have gold stars if you want to, but at the end of the day, I want to be able to get to the level of like understanding and have sympathy, right?
So I
So,
love that question, Dave. Like I would definitely take Miley to both of you guys. I
ah,
think now what I'm recognizing is two things. One thing that I didn't recognize before having Miley is there are a lot of things that have oral systemic relations. So if a patient has a pacemaker, like you're not supposed to have a smartwatch on. It would be very rare, but, like, you don't wanna set a smartwatch on their pacemaker. I never put some of that stuff together, like high aspiration risk, we're not gonna use ultrasonic, we're gonna have two-handed hygiene. So, even just making sure that you're really going through their medical records before, just to make sure that you're keeping everyone safe is something that I don't think I recognized before Miley. And the second thing is I'm recognizing these parents that have medically complex kids, they're at a lot of appointments, and there's already this amount of stress and expectation that most of them know that they should be brushing their kids' teeth. It's how. I was talking to a dentist and she's like, "Do you think that we are, miracle workers and that all of a sudden we can, work on their kids' teeth when they're not doing it at home?" And I'm thinking, I bet a lot of them don't know how to do it as in like, here are some comforting I don't like the word restraints, but there's like 30 different ways. Like we lay Miley in our lap. I put my legs over her so she's safe. When we are anytime I brush a child's teeth, my children's teeth, we come from behind so that they're getting used to that
mm,
position. You know how to flip the lip when there's with children with Down syndrome, sometimes it's hard to get the tongue out of the way. So if you are teaching how to do things, because they already pretty much everyone knows that they should be doing it, but it's the how. Because it is really, really tricky when a child will not open their mouth and or
Mhm.
so teaching techniques, and if you don't know techniques, then that is something like to focus your CE, um, classes on and stuff so that you can teach parents how to do it. When I was clinically doing hygiene, my goal was that every time a patient left, they had a new tip or trick. I'd be like,
I
"Your
love
floss
that.
is getting stuck. I'm gonna show you how to get out." And they loved me. I don't think clinically I was that great, but they left being like, "That was the most informative cleaning I've ever had."
no,
Well, the tip and trick that I'd like to highlight here is that hygiene school will not, cannot, is not intended to teach you everything you need to know to be the type of clinician that you need for your patient population.
Right.
And the two highlights I want to pin from our discussion is one, the medical history review. Like, what would it have been if you got a call before and said, "Hey, I see Miley on our schedule tomorrow. Is there anything that you are concerned about for this appointment? Is there something that we can do to help this be a more a safer, better, use an adjective that hits you at the right time for that conversation. But I am thinking in my mind, I'm like, if I had Miley, I saw in her medical history that she has Down syndrome and that she also has Ehlers-Danlos syndrome. I don't think I would have made the connection to high aspiration risk. I don't know if that would have been like an immediate connection. It is now because I know the story, right? It is now because now I've been in conversation with you. I've done a CE on this specific experience, and now it's in my mind. But before then, I don't know if I would have made that connection right away. And so to be really good at your medical history review and to then take that outside of the op and take more CE, things that are gonna be helpful for you to know. 'Cause I'm curious, Candy, if you've ever been with other medical professionals that you're like, "You shoulda known this,"
Oh,
but maybe
definitely.
they didn't.
Definitely. And I love that you're bringing that up because I don't think I made the connections that I do now. Like, if I see someone has a G tube, I'm pretty much assuming that they have aspiration, are at
So
risk for
Miley does have a
aspiration.
G tube.
She has a G tube. She's not
Okay.
eating orally. So, like, now my brain connects differently than it did. But when you're saying that the thought of like, you should know this, that brings me to what happened when we got Miley's teeth cleaned for the first time under anesthesia. We
Mhm.
were at Boston Children's Hospital, and Miley comes out, and there is calculus just caked on the occlusal surfaces. And I opened her mouth and I went to the dentist and I'm like, "How come you guys left all this calculus on the occlusal surfaces?" And, this is a Harvard program at Boston Children's Hospital, which is the number 1 hospital in the world.
And quote
Uh,
unquote, these are the people who quote unquote should know, right?
right, that they should know. And so, she, like, very confidently said, "We do this as Carrie's prevention measure." And I was like, "Oh my gosh, I should have known that." And then I started having thoughts. I'm like, "I bet everyone else knows that but me." And stuff. And so I couldn't get it out of my mind though. And I was like, that's so crazy that I didn't know that we're supposed to leave calculus on occlusal surfaces and different things. And so I start researching it. And I researched and researched. And the research was showing that children like Miley that are tube fed have different microflora than people that eat through their mouth. And the bacteria in their mouth puts them at really, really high risk for aspiration pneumonia and low risk for cavities. And so I started to think like, okay, they are at higher risk than any other population for aspiration pneumonia. This population, it's one of the leading causes of death is pneumonia, and they're really low risk
Ugh.
for cavities. And so I'm like, I must be missing something. So I called and got a hold of Harvard, the head person at Harvard, and it was a lot of phone calls. I got dismissed a couple times. And I was asking him and I said, "Hey, I'm looking at this research and it's showing that children like Miley are at high risk for aspiration pneumonia, low risk for cavities. Why are you guys leaving the occlusal calculus?" And he was a little bit rude to me. He was saying stuff like, we're no one's ever asked this." And I said, "Well, I'm a hygienist and this is my child, and so I need to know why." And he said, "We I'm not kidding. We're Harvard and this is the way we've always done it." And I was at this really grumpy point in my life because it's at the end of spring
Mhm.
break and I finally said, "She's my baby. We don't do things because it's the way it's always been done. We don't have that luxury. For Miley, we make evidence-based decisions." I said, "I've contacted other universities. They are not doing this. They are removing the calculus and the occlusal surfaces." And he agreed to review all my research. And so I sent him all the research, and within a couple days, they had a big meeting and they changed all the policies there. And so Boston Children's and Harvard will now remove occlusal calculus. But it was a really good example to me because I was having those thoughts like, they know, I don't. But if you have questions, it's like, do the research and look for yourself instead of having it. There's a lot of things that we do, it's because it's the way it's always been done without questioning them or using, like, some critical thinking skills to look at the research.
We get into what's called legacy errors.
Yes.
We just are doing something because it has always been done, and I am guilty of it, because I was taught one way and I started that even, like, gets filtered into the new things that I'm learning, and just l recently, I was like, "Oh my gosh, I had fused some things that took me down a path that isn't where I wanna go," and then you have to course correct. So what I love about this story is to not get caught up in "you should know," and not get caught up in "I know everything."
Yeah, it's important to notate that it's a little difficult. It's a difficult conversation to call, an office or in this case Harvard and kind of ask for research-based things. I mean, I'm thinking of myself as a hygienist, and one of the things that we do in our practice that could be better, right, is asking patients is there if there's any special accommodations when they're making a new patient appointment, right? Like what accommodations do you need for us to have a smooth and comfortable appointment? And oftentimes when we get stuck with the idea of like it has to be perfect, it has to be 100%. But you're a nice reminder that sometimes we just have to baby step these things to get to that level of care. That maybe the first appointment is just getting to know you as a patient and hopefully being able to open and talk a little bit of OHI. I know with kids specifically, I always encourage parents to bring their children over to their appointment so the child gets familiar with what a dental hygienist is, what a dentist is, but being able to kind of have those difficult conversations and implement a little bit of like, I'm a caregiver, I'm a mom, I'm a hygienist, I'm doing my research for my loved one. Here's what we're talking about, like being able to have that impact, that change, to be able to kind of create change in the policy. That's amazing. I just want to give you a high five because that's amazing. And you do this because you know best and you love and you care. And I feel like if we can kind of coach and teach a little bit of that mindset for all of us, if we can take away a little bit of what you just share with your personal story, starting tomorrow, we can kind of pay more attention to those details and do things with a higher purpose. So
Yeah, I think,
it's amazing.
like you said, we kinda get into our rut or what we're doing without, like, looking, are we providing evidence-based care or questioning things? When I called Harvard, I really thought I was missing something. I had spent hours researching, but I'm like, "I must definitely be missing something." But the longer we conversed back and forth, I thought, "Oh, I'm not missing
They're
something."
missing something.
Yeah, and so it was, and thankfully, the guy that was kinda rude on the phone, he was really gracious, and he which was a lesson for me because he ultimately was like, "You know what? Let me review this. Let me apologize. Let me bring it to, the whole committee and make a change." Where sometimes I think it's easy to dig your heels in and not be willing
Mhm.
to even change.
We don't like being wrong, and
No.
we do have education, and we do have things that we would like to share, and we do have a knowledge base that we are working off of, and we always have room to grow and to add on that knowledge base and to expand and improve, and that's one of the wonderful things about dental hygiene is that there's not an end, there's not a finish line. It's a continual evolution of how to be better for our patient population, and it could be just like a tweak in the type of toothbrush you're using or the type of like your dentifrice that you're using, and I'm imagining, Candy, when you're caring for Miley in this situation, you wanna get, like, the the biggest bang for what you're doing. So, and you're like, "I'm gonna have her lay down, and I'm going to do, like, a weighted blanket situation with my legs to have her feel more comfortable with me brushing her teeth," versus if she was standing and you're chasing after her, or, there are things that you can do that will make your efforts more impactful, even if those efforts aren't going to get this elusive proverbial gold star, right? So I'm curious, in addition to how you brush her teeth, are there things that you have added or things that have been super helpful that you have seen a change in her oral health because you have been using them?
Yeah, um, so initially, she wasn't very receptive to an electric toothbrush, but I knew because we didn't have as much time in her mouth that that would be a good thing to get her used to. Like, if we're gonna not be in there for the full 2 minutes, but 1 minute, let's use a electric toothbrush. And then, we use, Live Fresh, the activated dathomil tooth gel, and I was a little
Tell
bit
us a
worried
little bit
about
about what a decimil does. Like, why would that be a choice to use a dentifrice with a decimil in it?
because children with that are G-tube fed build
Mm.
a lot of calculus, even independent of having really great home care because it's just a different microflora. Without If you haven't cleaned a tube-fed person, it's hard to explain how much calculus and how fast it accumulates, like nothing I've ever seen before. But once we started using that and it makes it so that there's less plaque, less calculus, when I took her into a new dentist, I got a new dentist after that, she actually has switched all of her patients over because she was shocked the change that happened with us just changing the tooth gel that we were using.
'Cause it prevents the calculus to adhere.
Yes.
It's like I'm trying to remember the science behind it. It's like the decimil prevents the adherence of the pellicle, and so then the calculus can't build.
Y
Did I
s
get
so
that right? Somebody fact check me.
No, I think like, I know that there's, like, a reduction in plaque, and my problem was that they don't have great flavors, like, it's, like, mild mint and stuff like that. I've emailed them, um, but
We're waiting for a policy change.
Yeah, yeah, we're waiting for that change, and that's coming next, but Miley's been able to tolerate it, and so
Mhm.
we do that, we use an electric toothbrush. I actually have a little tiny toothbrush that lights up, and it's like a vibrating,
Ooh.
but it has helped because children with Down syndrome have everyone thinks that they have macroglossia. I think I remember learning that, but really they have a normal sized tongue, but very narrow upper and lower jaws. So it just appears that there's a huge tongue because in relation to their narrow upper and maxillary and mandibular jaw, it appears big. Having said that, it is harder to clean her teeth, to brush her teeth, and so we use a little tiny toothbrush that lights up, or I put one like I was joking once, I'm like, "Imagine hating your teeth being brushed and your new mom comes at you with, like, a light every night on her glasses." That'd be terrible. Um but she now at school, they said she requests to brush her teeth all day, and she used her device to tell the
Aw.
teacher she was gonna be a dentist. So now we're
Aw.
thinking our work has done and I'm like, "Not dentist, hygienist." Just teasing. So now we, are thinking, like, we did a little too good a job getting her
Mhm.
desensitized because girlfriend likes to brush her teeth now all day.
I love
So
that.
those are some of the changes that we made, and it was crazy because even, like, when she came to us, little kids didn't wanna play with her because there was such a strong smell, and now people, like, will randomly
Mm.
say, like, "Oh, her shampoo smells so good," or and stuff like that,
Mm.
and I'm like, "Oh, they can smell other stuff." Like, that's good.
Yeah. The Pereo's not masking the Pantene Pro V or
Yeah.
something, and but now the Pantene can shine through or whatever it is.
Yes.
Hopefully it's delicious, and I think, with any kid, I mean, anything that is preventing a barrier to be engaged with just makes things so much more difficult,
Yeah.
and I I think that having a mother and a father and a home life that has helped her flourish has really shown me how little changes and an extra effort on my part as a provider can go a long way with advocacy, with patient care, and with supporting these families who every day have a mountainous struggle of how to best care for their children. And we as providers have the opportunity to be cheerleaders and to give them support and options and really the things that they need in order to try, to make a small difference in a already really challenging situation. So, Candy, we just want to thank you for coming on today and sharing your experience with Miley. And I hope that listeners took a few tips and tricks from Candi Kidd, and you are continuing your work as a dental professional. And whether it's in the chair or on a podcast, nobody leaves a conversation without something to take away from Candi Kidd.
Yeah.
Thank you, Jessica.
And Candy, your story reminds me of that saying, like little hinges swings big doors, right? Because
Oh,
it's the ongoing, the consistency, the little wins, the little successes, the gold stars that we get as we continue to push forward. It's truly inspiring. And just thank you for sharing your story. I'm sure there's more that you have to tell us. We'll probably have you back, but I am excited to, start making those little changes in the way I practice and hopefully inspire the rest of my hygienists within my practice because I have seen some special needs. And I have a parent or two stop everything and say, you know what? Thank you so much for taking extra care of my child. And I was like, but I was just doing the most that I can do. I don't know if it was extra care, but I just did what the best of with what I got, right? And so
Sometimes people think extra care is a thorough health history review. Sometimes people
mhm.
think extra care is knowing about what our patients' medical history does say, or asking them, is there anything that you're concerned about, or is a special note for this situation? Sometimes people think that's extra care. And I hope everybody leaves this conversation recognizing that that's not special care, that's our care, and to remember to practice to that standard of care, and remember that this candy is good for your teeth.
Thank you,
thank
Candy.
you.
That's a wrap on today's episode of A Tale of Two Hygienists podcast. If this conversation made you feel seen, inspired, or even just a little fired up, share it with a fellow hygienist or fellow dental professional. Share it with your neighbors, your friends. Share it with everyone. That is how this community grows.
Make sure you subscribe, leave us a review, and connect with us on social media so that we can keep on going with this conversation. Remember, your career, your voice, and your story matter here. We're David,
And Jessica,
and until next time.
keep learning, keep laughing, and keep showing up for yourself and for each other.
This has been a production of Endeavor Business Media, a division of Endeavor B2B.